A new survey from Lurie Children's Hospital finds the mental impact of the pandemic on toddlers and children is profound. Nearly half of parents surveyed said they have asked their doctor for help with their children's emotional health. Joining us to tell us more about the survey and give parents some tips is Dr. Matthew Davis, a pediatrician with Lurie Children's Hospital. Good morning to you, Dr. Davis. Thank you for joining me. Wow.
Pleasure.
You know, we've been hearing about mental health issues, but then to hear toddlers, I want to know, though, what surprised you most about the results of this survey?
What surprised me most was not that parents are experiencing these symptoms in their young kids, but rather the sheer number of families that have reported these behavioral health concerns since the beginning of the pandemic. When you add it all up, we're looking at about half of all families of 2 to 11-year-old kids in Chicago. And if we understand that number across the city, it's over 70,000 children who may be affected.
Wow. Okay, let's talk about what mental behavior changes are these children experiencing, for example. What have parents said?
Well, the most common experience of parents and what they told us about was that their younger kids were having more tantrums than they did prior to the pandemic. They may have lost some of their developmental milestones. For example, they may have been potty trained, but then they lost that ability to help control things. And then other parents reported their kids were having more problems with sleeping, including nightmares and trouble falling asleep.
So
some parents even said that their kids have been experiencing headaches and chronic belly pain.
Wow.
So all these symptoms can be common in younger kids who can't explain what they're going through, but are nevertheless showing us symptoms.
Okay, so let's talk about help and resources for parents, where they can turn and when it is time to turn for that.
The first line of support is really primary care providers for families. And we learned that half of the families who are concerned about their kids' behavior had already turned to their primary care providers for that sort of help. Behavioral health specialists are also vital, although we don't have enough of them right now in our communities, and we need to turn to the combination of primary care providers and behavioral health specialists to help us all get through this.
And you know, even though they're not in school, at least not all of them, that's another place you recommend, right? School resources?
Absolutely, and that's it's been one of the toughest things in the pandemic is that we haven't been able to engage teachers and other members of the school community as much as usual. They're usually part of the front line in terms of detecting when kids are having more difficulties. If parents are looking for more support, they can go to the Center for Childhood Resilience website through Lurie Children's, and there are some many tips and resources for parents that are recommended for parents navigating these tough waters during the pandemic.
And I think it's also interesting that you're recommending to parents self-care. Let's talk about how important that is for the whole family.
You're absolutely right, because young children are perceiving the emotions of the older kids and the grown-ups around them. So focusing on self-care among adults can help everybody have a better day and also help parents feel more ready to support their children who are having this emotional distress.
Yeah, take care of yourself.
Self-care can include getting outside for a little bit of physical activity, doing something that you all enjoy, for example, reading a book or singing some songs or dancing, and enjoying some time together that isn't focused on the pandemic, instead is focused on what you all enjoy, how you all enjoy spending time.
And I also thought it was interesting that the survey found 1 in 5 parents said they were unable to access mental or behavioral health care for their child at some point. They feel lost. You know, where do they turn? Some of the things you just mentioned, but what's an easy way for them to try to take care of this?
One of the best things parents can do is look for those tips and resources I mentioned earlier from our Center for Childhood Resilience that can help them feel a sense of more command and mastery of the situation, and also relay to their children's primary care providers what their concerns are, because we and other healthcare systems here in the city have been helping primary care providers get more confidence and a sense of competence and confidence in managing these symptoms for families for their young children during the pandemic.
I want to make sure parents know, what is the website people can go to?
They can go to the Lurie Children's Hospital website and search for Center for Childhood Resilience, and you can find the tips and resources right there on the website.
Perfect. Dr. Matthew Davis, a pediatrician with Lurie Children's Hospital. Thank you for joining us this morning, an important topic. We appreciate it.